For those that don't know me, my name is Aliya Omer, and I recently joined AstraZeneca 6 months ago as the Vice President and head of the U.S. breast cancer franchise specifically. So I'm excited to be able to share some of the exciting data related to the OlympiA 6-year data related to Lynparza. So to your question, I think there are a lot of challenges in the HER2 negative space overall, and I think that there are 300,000, newly diagnosed patients every year, the majority of which are HER2 negative. And for those that are diagnosed in the early setting, a third of them will actually advance to the metastatic setting. So when you think about, what the challenges are, I think it is really imperative for us to keep investing in innovation that helps early breast cancer patients so that we can prevent disease progression. So it depends, obviously, on a lot of different patient characteristics. So there's really no one size fits all. Over the course of time, the HER2 negative space has really, HR positive HER2 negative space has evolved significantly from one that was dominated by, chemotherapies to targeted therapies to now antibody drug conjugates, et cetera. So when you think about standard of care specifically for where Lynparza sits, there's actually no other really compelling sets of data for germline-based BRCA-mutated patients with a BRCA1 or BRCA2 specifically. So that's where I think it really serves a need for these patients. And it is actually the first and only PARP inhibitor to really serve the need as well. Yeah, so what was most exciting this past December at San Antonio Breast was really the 6-year overall survival data that was shared. And before I get to the specifics on overall survival, let me take a step back and just remind, perhaps the audience about the specifics about OlympiA in general. So these were patients that received chemotherapy either in the neoadjuvant or adjuvant space, so before or after surgery, and then received Lynparza in the adjuvant setting for 12 months. And what the primary endpoint demonstrated, which was IDFS, the secondary endpoint was DDFS, and respectively, what each of those stand for are the recurrence, either invasive or distant recurrence, and each of those respectively were decreased by 35%. So something certainly to note. The overall survival data, the reduction in the risk of death was 28%. So what that translates into, what does that mean? What that means is that after 6 years, nearly 9 out of 10 patients still survived after receiving 12 months of Lynparza in the adjuvant setting. So really exciting results, long-term results, I would say, that we've really demonstrated sustained response from a survival standpoint. So I think there are a couple things. I think one, it reinforces the importance of patients being tested for BRCA and other biomarkers, by the way, at diagnosis, because only if it's done at diagnosis can a physician be really well informed about what the treatment choices are and what's appropriate for that patient. So I think the first implication is really reinforcing the need for testing early on. And then I think the second is that it really paints the picture of long-term results, which, as you know, take time to evolve as data sets mature. And I think this is, really reinforces what we saw 2 years ago in overall survival and just builds upon that.